Pediatric feeding disorders is a true debilitating condition that may lead to developmental delays with long-lasting consequences. Feeding disorders include problems gathering food and getting ready to suck, chew, or swallow it. For example, a child who cannot pick up food and get it to her mouth or cannot completely close her lips to keep food from falling out of her mouth may have a feeding disorder. Swallowing disorders, also called dysphagia, can occur at different stages in the swallowing process. In the oral phase, sucking, chewing, and moving food or liquid into the throat. In the pharyngeal phase, starting the swallow, squeezing food down the throat, and closing off the airway to prevent food or liquid from entering the airway, also known as aspiration, or to prevent choking. Esophageal phase, relaxing and tightening the openings at the top and bottom of the feeding tube, in the throat, the esophagus, and squeezing food through the esophagus into the stomach. Speech-language pathologists play a central role in the assessment, diagnosis, and treatment of infants and children with swallowing and feeding disorders. The professional roles and activities in speech-language pathology include clinical and educational services, diagnosis, assessment, planning, and treatment, prevention and advocacy, education, administration, and research. It has been reported that 25 to 45% of typically developing children demonstrate feeding and swallowing problems. A few important roles and responsibility for the SLP include providing prevention information to individuals and groups known to be at risk for pediatric dysphagia and feeding disorders, as well as to individuals working with those at risk. Developing treatment plans that incorporate the family's dietary preferences, providing treatment, documenting progress, and determining appropriate dismissal criteria. Recommending a swallowing and feeding plan for daily management of swallowing and feeding activities that is referenced in the Individualized Educational Program, Individual Family Service Plan, or 504 Plan. And diagnosing pediatric dysphagia is also one of the responsibilities of the SLP. It is estimated that more than 1 million children under age 5 nationwide have severe feeding disorders. $32,000 is the annual cost to support a child on a feeding tube. A few signs and symptoms of feeding and swallowing problems in very young children are as follows: arching or stiffening of the body during feeding, irritability or lack of alertness during feeding, refusing food or liquid, failure to accept different textures of food, long feeding times, difficulty chewing, difficulty breastfeeding, and coughing or gagging during meals. The SLP may work as part of a feeding team. Other team members may include an occupational therapist, a physical therapist, a physician or nurse, a dietitian or nutritionist, and a developmental specialist. If feeding therapy with an SLP is recommended, the focus on intervention may include the following: making the muscles of the mouth stronger, increasing tongue movement, improving chewing, increasing acceptance of different foods and liquids, improving sucking and or drinking ability, coordinating the suck-swallow-breath pattern for infants, or altering food textures and liquid thickness to ensure safe swallowing.